Hello. Now we'll see the anatomy of human heart. In the first here you can see the location of the heart. Heart is situated in the middle mediastinum behind the sternum and the adjoining part of the costal cartilage in such a way that the left two-third of the heart lies left of the median plane and one-third on its right. So here in this diagram you can see the heart and other structures situated over here. So here is the here is the heart sitting over the diaphragm, and here two lungs we can see. Now the chambers of the heart. In your lower classes you have already learned about the chambers of the heart. So we have the right atrium, then we have the right ventricle, then we have the left atrium and the left ventricle, and here we have the superior vena cava, then comes the inferior vena cava. This is the pulmonary trunk over here, and here we have the aorta. Okay, then again we know that this atrial musculature atria is thinner than the ventricles. We have the ventricles here, ventricles are thicker. Again in this diagram you can see both the ventricles. So here we have the right ventricle and here is the left ventricle. Again the left ventricle is more thicker than the right ventricle. Then what are the external features of the heart? You can see that the heart has got an apex, base, anterior surface, inferior surface, and some borders like upper border, right border, inferior border and left borders. So now we are going to see the detailed anatomy of the heart. So here in this first diagram we are seeing the anterior aspect of the heart. So you should know the structures which is seen on its anterior surface. Anterior surface is also known as the sternocostal surface. Sternocostal surface, because as it is related to the sternum and costal cartilage. So what are the chambers visible? So we have the right atrium, here comes the right ventricle and part of the left ventricle, and we have the left auricle. Left atrium is not visible on the sternocostal surface because it is masked by the great vessels. We have the aorta and the pulmonary trunk. Then what are the other structures visible on the external surface, sternocostal surface? We have there is a sulcus over here, that is known as the anterior atrioventricular sulcus, and here we have the anterior interventricular sulcus. The other structures which is visible on the sternocostal surface, I already told you about these great vessels. Here we have the posterior surface, is also known as the base of the heart. Posterior surface is mainly formed by the left atrium and partly by the right atrium. 2/3 is formed by the left atrium and 1/3 is by the right atrium. And here you can see onto the left atrium we have 4 pulmonary veins are there opening. So here 1, 2, 3, 4 pulmonary veins are opening into the left atrium. Then so here the detailed view of the sternocostal surface again. So what are the structures? I already mentioned you that we have the right atrium with the right auricle. So here is atrium and here is auricle. Then we have the right ventricle partly by the left auricle and the left ventricle. Then I already mentioned about the atrioventricular groove. It is also known as a coronary sulcus, and there is anterior interventricular sulcus, and there is a pulmonary outflow tract. What is a pulmonary outflow tract? This area is known as a pulmonary outflow tract. And the base, I already told you, posterior surface is also known as the base of the heart. So mainly you can see the left atrium. And a small portion of the left ventricle is also visible over here, and there is part of the interventricular sulcus is present, and we have the part of the right atrium, mainly actually left atrium. You can see that just behind the base of the heart, what are the structures present? Just behind that we have the descending thoracic aorta, esophagus, and oblique sinus of pericardium is also present posterior to it. And inferiorly, if we see inferiorly, we can see the coronary sinus and the coronary sulcus is present. Coronary sinus and coronary sulcus is present. Then coming to inferior surface or the diaphragmatic surface, this is the part of the heart where which is related to the central tendon of diaphragm. Central tendon of diaphragm. So this part is known as the central. This is the central tendon. So you know this particular area is situated over here. What are they? Mainly formed by the left ventricle and partly by the right ventricle. Partly by the right ventricle. Then coming to apex of the heart, you can see this is the apex of the heart. It is here. Apex of the heart means it is, you can see which chamber we have the left ventricle. Apex is formed by the left ventricle, and this you should remember, the apex of the heart lies at the left fifth intercostal space. Left fifth intercostal space you have the here, which is 9 centimeter from the midline. From the midline, apex lies almost 9 centimeter or just medial to the mid clavicular line. We have the here we have the clavicle. This line is a mid clavicular line. Just medial to the clavicle. So remember this point. Apex of the heart lies at the left fifth intercostal space, 9 centimeter from the midline, just medial to the mid clavicular line. Then what are the borders? So we have 4 borders are there. So this is the superior border. So here comes the right border, here is the inferior border, and we have a left border. Okay, you can see the right border. You can see what are the chambers. We have the right atrium, okay, and both atria. And remember this one, root of great vessels. We have the ascending aorta and the pulmonary trunk. These two arises from this area. That means superior border is related to the, or it is it is related to the root of these two great vessels. Then here we have the right border. Which chamber? We have the right atrium. Then upper part we have the superior vena cava. At the lower part we have the inferior. The whole is the right border. Then we have the left border is mainly formed by, what are the structures? We have the left ventricle, mainly left ventricle, and part of the pulmonary trunk, part of this pulmonary trunk. Then we have the inferior border is mainly formed by the right ventricle, 2/3, and 1/3 is by the left ventricle. Then what do you mean by clinical base of heart? You should know this term. What is the clinical base of heart? Then clinical base is nothing but the superior border of the heart. Normally in anatomy you call it as a superior border, but clinicians are using the term base of the heart. So clinical base of the heart is the superior border of the heart, okay, where you can see if you make a line from the second intercostal space to the third costal cartilage, okay, this costochondral junction, okay, from the second intercostal space to the third costochondral junction, if you make an oblique line, so that represents the clinical base of the heart. Why it is called clinical base of the heart? Because this is the site of attachment of great vessels of heart. Site of attachment of, we have the pulmonary trunk, that is aorta and pulmonary trunk. Both arises from this area. That is why it is known as a clinical base of heart. Then what are the sulci on the heart? Already I told you we have the atrioventricular sulcus, that is anterior atrioventricular sulcus. Then there is an anterior interventricular sulcus. So this is the atria and ventricle. So we have the posterior atrioventricular sulcus, and this is a posterior interventricular sulcus. You should remember atrioventricular sulcus is known as a coronary sulcus. Then